Hi, this is Dr. Peter Malouf. I'm a diplomat of the American Board of Dermatology and a minimally invasive cosmetic surgeon. I'm going to start a new series. It's basically an opinion and information series where I provide my own opinion about a particular treatment or a particular device that is out on the market and help my patients understand whether I believe it's a viable treatment. And basically, when we're assessing different treatments or devices, I've come up with an acronym that I call SAFE. And SAFE, the S stands for safety. Obviously, we want something that's safe and has a good risk benefit profile. The A in the acronym SAFE is for affordable, which can also be translated to cost effectiveness. If we're spending money, we want it to work and not just be a fancy piece of equipment with false promises. So the F in the acronym SAFE is for foreseeable, which is also based on the predictability. In other words, if you take 10 patients and treat them with the device or the treatment, are we going to have a predictable outcome? And finally, the E in the acronym SAFE is for effective. What are the level of results with a particular treatment and or device? Is it subtle? Is it drastic? And so forth. I've come up with this series because over the past approximate 20 years, I've felt like I've seen enough patients and dealt with enough different types of treatment modalities that I can be helpful to patients trying to decide if these treatments are effective for them and suitable for their complaint. And so I believe it's very important to consider these things when deciding what treatment you may decide to try for yourself. So to kick the season off, I'd like to start with Kybella, which is an injectable brought to us by the company Allergan. And actually it's not new. It has been around in different forms for several years, and I myself tried it several years ago when this concept came out about melting fat with injectables. So first of all, Kybella, we have to ask ourselves, what is it? It's basically a deoxycholic acid. And so what is that? Deoxycholic acid is a bile acid, basically in our bodies, in your bile, which is produced by the gallbladder. This substance is secreted into the gut to emulsify fats. And so it makes sense that maybe if you inject it into fatty areas that it may melt away the fat. In theory, that's really cool science. But if we look at my acronym, let's look at safety first, risk benefit. I've found that this injection, first of all, causes a great deal of discomfort, extreme burning that lasts several hours, and the second problem I have with it is that it produces an intense amount of inflammation and swelling along with long-standing numbness. For example, when it's injected under the chin, which is a very common complaint for double chins, we see patients complain of large degrees of swelling, numbness following intense burning. Finally, if we get to affordable, the next item on the acronym, the A in the acronym, I think it's pretty highly priced for what you get, and it could be around $1,500 each treatment, which multiple treatments are required, so it adds up pretty quickly. Finally, our next, actually, we have F, which is foreseeable, or is it predictable? I think it's highly unpredictable because results have been very variable in my opinion and my experience. And lastly, in the acronym SAFE, we have E for effective. And really, what are the results? Is it subtle or is it drastic? Is it moderate? And in my opinion, I believe it's very subtle. In fact, I'm very underwhelmed with the results. So for me, Kybella is not safe. If we're looking at the acronym SAFE, it's not a safe bet anyway, in my opinion, since I believe there are many other procedures we can do that provide results with less downtime, less cost, and more results. So I hope you enjoyed the first session. There will be many more, and I hope to See you soon. Thank you very much.